So there's a lot of conditions that lead to knee replacement. The most common would be osteoarthritis, or what people typically call the wear and tear type of arthritis, which, although it's generally runs in families and is thought to be genetic, it's the most common type, and it can happen for multiple different reasons. There's also post-traumatic, or if you've had like a prior injury that damaged the cartilage in your knee, or rheumatoid arthritis, which is more of an inflammatory arthritis, which there's a whole class of that, being rheumatoid arthritis, psoriatic arthritis, sometimes related to gout. Those are more where, instead of it being a wear and tear, where there's damage to the cartilage then leading to inflammation and more further loss of cartilage, these are more your body sort of attacks the cartilage and leads to a loss of cartilage from autoimmune, or basically your body's abnormally attacking the cartilage. I'm commonly asked what's the right age, or if there's an age limit for knee replacement. In general, people used to always be told that it was, oh, you have to wait till you're 60 or 65. And I think the real thought on that has changed. The right time to do a knee replacement is when your pain is severe and it's stopping you from having a good quality of life. We used to want people to wait as long as they could because, number one, the parts that we had to use weren't as good and probably didn't last as long, which I think we've solved somewhat. Also, if you're younger when you have this surgery, the odds are that you're gonna have another surgery, that things will wear out. And the younger you were, the more likely that was to happen. And revision or redo knee replacement was much more challenging, and the options for that surgery were more difficult, and the outcomes weren't as good. Whereas now we have the capacity, first of all, for the first knee to last a lot longer, and secondly, I think the revision parts are so much better that surgery goes better, it's a lot smoother, and has better outcomes and lasts longer. So I don't think there's really an age that is a cutoff. It's more when you've reached that limit and you've tried everything you can and you're miserable and you don't want to do things that are important to you and that make your life better, make you live the life you want to live, then that's when it's time to do it. Well, again, it depends, as far as what to expect from an appointment, it really depends on what they've been through. So if you've been to your primary care doctor or rheumatologist or even another orthopedic surgeon and they've done injections and you've tried, anti-inflammatories and basically anything you can think of over the counter, then we're going to talk more about surgery. If you haven't tried those things, then certainly that's something we'll talk about as far as what the likelihood they are to work for you, depending on what your x-rays or your exam findings tell me, we'll kind of give you what the chances of those things are to work, and then also to talk about surgery if and when that's appropriate. The pain that you experience with the surgery, I think, is probably the one biggest advancement we've had in knee replacement specifically, but in joint replacements in general. That, in the past, I always kind of relate the story to my patients that when I was in residency, we would do a knee replacement and it was expected you're going to be in the hospital for 3 or 4 days, most of that time laying in bed in misery and hitting your pain pump. I don't mean to laugh at those people's pain, but that's just kind of what it was. And I laugh because it's so different now. I mean, now we're doing outpatient surgery and people are sitting up, eating breakfast saying, boy, doc, it really wasn't that bad. So I think that whole mentality has changed quite a bit. And that's because of how we've changed how we address pain. We do a lot of different blocks. The anesthesiologist can do blocks, which is basically numbing up your leg. I inject a lot of material into the knee at the time of surgery that helps to control pain. And we also pre-medicate you, giving you medication before surgery, to kind of get your body ready to adapt to that pain and make sure that, your pain is well controlled even before you get out of the operating room. As far as complexity of the surgery, that's very varied. Certainly people that have more extensive arthritis are going to have a little bit more work to do in surgery. Somebody that has a really, you'll see people walking around that have kind of crooked legs or big bow-legged, big bows to their leg, or have a lot of what we call valgus or in-towing kind of thing with their knees. Those surgeries require a little bit more manipulation, and that's kind of where the skill of the surgery is getting that leg aligned. And I don't know that equates to more pain, but it definitely is more challenging and a longer surgery time. The sooner you can get up and moving, the sooner you can start bending your knee, the better your outcome will be. And so getting up and moving right away, not only that, not only does it excel your recovery, but it also prevents other complications like blood clots, or DVTs that are a common complication after hip and knee replacement, which I think the rates are coming down significantly from what they were. And a lot of that's because of early motion and getting up and not being in an independent position with your leg, blood just kind of pooling in your leg. So most of my surgeries right now are at Mercy West, but we also go to Methodist West here, as well as Lakeview Surgery Center is where we do all of our surgeries at present. So Iowa Clinic being an independent group, we have the option of going wherever suits your needs or where the best is fit for me and for my patients. So again, another great thing about the Iowa Clinic, and a big part of why I came here, is that we do have good coordinated care between our primary care physicians, our specialties, our ancillary services, where you may have an issue where you're getting injections with our pain doctors who are basically in the same office that I'm at. And then, we'll do our thing and possibly send you on to physical therapy, which is right next to us in the same office. I also have intricate, conversations with our primary care doctors, see them around the buildings of the clinic as well as in the hospital. We're all very linked together, and if there's anything special that they need or that I need from them, it's a simple phone call, click on the computer, text message. We're all very well linked together, and the communication is very smooth. So a lot of people think that when they hear they have arthritis of their knee, that it's this helpless, hopeless thing, and you're gonna have surgery, and 5 people that had bad outcomes, and they're afraid of it. And I think that's probably one of the biggest things that I work towards, helping patients through, is that this is a good surgery. It's something that helps a vast majority of patients. And one thing I always remind people of, you may have heard somebody that has a complaint about a knee replacement, but in that same conversation, there's probably 10 people sitting around you that are quietly having a great life and very happy they did it. They're just not as verbal about it. So realize that this is a good surgery. It really helps you. And most people that have it say, oh, I wish I would have done it, blank years ago, 4 years ago, 5 years ago, and are very happy they did it. So it's not something that I'm going to force on anybody, but when you're ready for it, it's a good surgery, and there's no need to wait. It's something that if you're thinking about it, you might be ready for it. I will help you get there, and I know that you'll have a great outcome. So we have multiple scheduling options. You can always, first of all, call. You can schedule appointments online directly, as well as, go through your primary care physician if you're not sure what was that guy's name or who's the right person to see. That I'm sure they'll steer you in the right direction to our office.